Good day. Welcome to a new program of Corruption USA. Today we're going to talk on healthcare. The corruption of healthcare. The hidden agenda. The dirty secrets. It's a bilingual program, English and Spanish. Hoy vamos a hablar acerca de la salud, del sistema asqueroso, repugnante de la salud en Estados Unidos. Van a ver por qué es un privilegio para algunos y un tormento para muchos. Today we're going to see why it's a privilege for a few and a damage for many. Clear example, no censorship. Ejemplos claros, sin censura, comparables a otros países, con menos y con más, y lo hacen mejor. Countries with less resources and more resources, and they do a better job. Why? The greed. La avaricia es el problema, es la raíz, la avaricia. The greed is the root of the evil. We want to see clear examples, no doubts, clear facts, alarming examples of what's happening in the USA. De qué es lo que está pasando en Estados Unidos de América. Cómo afecta la salud, el daño colateral, how it affects health, the collateral damage, the alarming collateral damage to its people. Daño colateral al ciudadano, al que vive en Estados Unidos, por la avaricia de los ricos, de los intereses especiales. Espero que disfruten el programa. Gracias. Thank you. Corruption USA and the lack of righteousness. La corrupción en Estados Unidos de América. Healthcare, la salud y la falta de justicia. Healthcare for all, a gimmick in the US. The greed, the problem. That is what we're going to see. We're going to see a clear picture why it's a privilege for few and a handicap for many, many in the U.S. Healthcare, where it is a right for many countries. It's a right for the citizens. Donde es un derecho la salud en muchos países, y vamos a ver ejemplos alarmantes. We're going to see examples that are obnoxious and are happening in the USA. It's a bilingual English and Spanish. No censorship or makeup. The naked truth. Bilingüe. Inglés y español, sin censura, no hay maquillaje y el destape. Pay attention to this. Ponga atención a esto. Government censorship, protecting you from reality. La censura del gobierno es protegerte de la realidad, que no veas la realidad de la situación. So you don't see the situation clearly. That's a censorship. Hiding. Producer, Eduardo Martinez Arizala. YouTube contact, corruptionusa.now and @gmail.com. Ahí tienen el correo. Facebook, Corruption USA Now. En Facebook estamos Corruption USA Now. Programa de hoy. Today's program. Inhumane Healthcare in USA. Programa del día de hoy. El sistema de salud es inhumanitario en Estados Unidos de América. El gran negocio. La falacia, la gran mentira de que la salud en Estados Unidos es maravilloso y es un desastre. The big business, the greed, the money, the fake, the laughter that the healthcare in the USA is great. It's a disaster. Hidden details. Detalles ocultos. The bottle is open. El destape del botellón. The dirty secrets. We're going to see that it's so dirty that it's a latrine. Vamos a ver que los detalles ocultos son tan sucios que es una letrina, es una cloaca. La agenda secreta. The secret agenda. We're going to see the real reason why the fix can't be done, because the collateral damage. Collateral damage is an action that damages other, and fixing the system will cause a collateral damage to the people that are benefit from the actual system. The greed that are benefit from the healthcare crisis and healthcare abuse. Those few rich people will be damaging to make a fix. Vamos a ver que el daño colateral es cuando toman una acción y esa acción perjudica a algunos. Entonces el daño colateral de arreglar el sistema de salud, de enderezar el sistema de salud, es que a las que están lucrando de la salud del sistema americano, del sistema actual atorrante y asqueroso, corregir ese sistema perjudica los intereses de ellos. Vamos a ver eso. Y el daño colateral del sistema actual son los ciudadanos americanos, la salud de los ciudadanos americanos, de los que viven en este país, ciudadanos y residentes. The collateral damage, the action that's being done with the current health system, who's damaging is the health of the citizens and residents, the people that live in America. That's who are paying the price and taking the bullet. Medicare brutality in the zero accountability policy that's been established from the federal government down, and it's all the way to the municipality. Impunity, non-guilty. La brutalidad de Medicare, cero responsabilidad, impunidad en salud y no hay culpable. Medicare fraud and abuse. Fraud by the people that benefit from Medicare, and abuse even from the own government, abusing on the people. No ethics, no accountability, no democracy, no hay ética, no hay contabilidad, los números no cuadran, no hay democracia, no se habla, no se oye, no se ve. You hear nothing. You talk nothing. And you see nothing. That is the picture. Ese es el retrato. El fraude de Medicare y el fraude de Medicare a los ciudadanos, a la gente que vive en este país. El abuso. Handicap for medical providers. Limitación a los proveedores de servicios médicos. Insurance companies choose them. Relationship can end for no just cause. We're going to see why. Las compañías de seguro escogen los proveedores, escogen los médicos, los laboratorios, los hospitales, y en cualquier momento le dan la patada. Le dan la patada y para afuera que van. Se acabó, no importa la razón que le dé la gana a ellos. So, in any moment, the providers, the doctors, labs, hospitals, whatever, the insurance company selects them. And at any moment, they can terminate the relationship for no reason. Just like that, no reason. The factor, the greed factor, la avaricia. So they keep doctors that look out to the insurance company, hold on specialists, referrals and tests, regardless whether it's necessary. You know, it's convenient for the insurance company that a patient doesn't go to see a specialist. He doesn't go to see a heart doctor. He doesn't go to see a, ear, nose, and throat doctor. He doesn't go to a gastro because it's less expense for the insurance company. Even if it's necessary, it doesn't matter. Doctores que actúan en acorde al beneficio de la compañía. Especialistas y pruebas limitadas, aunque sea necesario. O sea, aunque tú necesites ir a un gastroenterólogo, un cardiólogo, no te mandan porque si te mandan es un gasto adicional y perjudica a la compañía actual. Entonces no te mandan. It's so obnoxious and so filthy that most insurance companies pay the doctor an additional monthly money if you don't go see a specialist when you have a PCP. So if it's a conflict of interest. If he sends you to a specialist, he gets less money. So I mean, if you got 100 patients, it's thousands of dollars. It can be thousands of dollars a month benefit for him, and keep the insurance company happy. So si no te manda el referido, es un beneficio para él, porque coge más dinero, la compañía de seguro le da más dinero y la compañía de seguro está más contenta, tiene más agarre con ese médico porque los está beneficiando, aunque la salud del paciente se perjudique, no importa. Es el beneficio, la avaricia. Handicap for patients. Perjuicio para pacientes. Medicare, Medicaid, and Obamacare. Make them mandatory. Que sean mandatorios. O que paguen una penalidad. So a doctor provider doesn't want to take Medicare, Medicaid, Obamacare, make it mandatory. If you don't want to take it, pay a fine. And the money goes into the system to bring down the cost of Medicare and Medicaid. Que paguen una penalidad y el dinero sea para abaratar los costos y mejorar el servicio de Medicare y Medicaid. Entonces ya acabas el problema de que no hay médicos en este plan. ¿Tú me entiendes? No hay especialistas. Queda 100 millas. The specialist is 100 miles away. You eliminate that problem because now there's more money and there's more doctors. Because some will pay the fine and some will opt to be in the system to not pay the fine. Affordable health care, Obamacare, high deductibles, limited providers. It becomes non-functional to many working class. It's like a brick wall. Don't see us because there's a severe financial consequence. And people, get sick, but I should, but I, blah, 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 blah. But the wall is there. The penalty is there. You got to make the deductibles and co-pays functional for working class. Yes, it is okay for some. Obamacare has done some good, but for others, it's just a high premium, high deductible, high co-pays. It's just a burden. It's a non-functional system that needs to be corrected. Es un sistema que no es funcional para muchos y tiene que corregirse. A quick quote from the Bible. Una reseña bíblica. Amado, yo deseo que tú seas prosperado en todas las cosas y que tengas salud, así como prospera tu alma. 3 Juan del 1 al 2. Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. John 3:1-2. So there you see a direct link between your spiritual health and your physical health that God chose. Ahí vemos una relación directa, la salud espiritual con la salud del cuerpo. Una buena salud espiritual, dice la Biblia, prospera la salud del cuerpo. A good spiritual health prospers your physical health. That's what the Word of God says. The biggie, el grandote, prescriptions and medical procedures, the cost, medicinas y procedimientos médicos. You know, I've been to the hospital, to ER, and there's been like a $9,000 bill from the hospital. And the insurance companies, you know, they pay 10% of it, a dime on the dollar. And just you're overbilling the grossly, you know. So if you don't have insurance, they start by $9,000. But if you have insurance, you know, they're going to get $1,000. They're going to get 1/10. Si no tiene seguro, fui al hospital, mandaron una cuenta de casi 9,000 o 8,000 y pico. El seguro le pagó el 10%. Entonces, si no tiene seguro, imagínate, te dan un bill de miles de dólares. Y si tiene seguro, se le mandan el bill a la compañía de seguro por el 10%. Una asquerosidad, una falacia. It has become a privilege. Healthcare has become a privilege. Healthcare is a human right. It should be. Del dicho al hecho, la salud es un derecho. It's so bad in the U.S. Tan malo. This was I did it, that's slide in 2015. And Alina, a medication. It's nitazosanide, whatever. It costs $31.82 at the public pharmacy. That's a supermarket in Florida. $36.39 in Walmart pharmacy, and it's 68 cents in Nicaragua. 54 times more expensive in the U.S. So it's not only that the brand name, it's that outside here in the U.S. there's X-Drug, that's a brand name. Outside there's the brand name, and there's a ton of generics. So that is, 54 times. When I went to the doctor, I said, I'm taking this medication that I brought from Nicaragua. He said, that's good, but it's too expensive here. So I said, maybe $2 a pill, $3 a pill, paid 60 cents, on the pill in Nicaragua. When I went there, and he said, we prescribed it to me, and he said, well, it's too expensive. It was $31, $36, 54 times. Una pastilla que cuesta 60 centavos en Nicaragua y cuesta $31 o $36 en Walmart, cuesta 54 veces más caro. ¿Qué clase de garrotazo es eso? ¿Qué clase de ladronazo es eso? El sistema de salud. Amazing facts. Alarmante. Januvia. RX diabetes. 420 to 440 in the States. Brand name, outside $20, generic $9 to $15, So you divide what you basically pay here for a month's supply, you pay the generic outside for 4 years. 1 month to 4 years. If you go for the low generic. And there's a ton of them. Lo que pagas aquí por una medicina de marca un mes, que solamente es de marca, no puedes coger otra. En un mes, allá paga, afuera paga 4 años para la medicina. 48 veces más. It's astronomical. It has to stop. That's why I have to sometimes buy medication from outside because it's just too much money. Another biggie. Otro fenómeno. Who's made the rules? Who's made the system? The politicians. Perhaps a change in politicians. Electing working class people and honest. Un fenómeno. Ladrones políticos al volante. Un cambio. Votemos por hombres honestos y trabajadores. Por ejemplo, aquí en San Antonio, you have Antonio Díaz running for Congress. He's a cab driver. But he's an honest man. A man that loves justice. Un hombre que ama la justicia. So, when you're thinking, you know, who's making the rules, who's making the disasters, the people that are there, they've been for years and years. Maybe it's time for a change. Vote for somebody else. Drug companies. U.S. runner. Up. Worst nation. GNP. On healthcare. GNP is the gross national product. The gross national product, it's all services and products produced in a country. Services and products. It's 18% of the U.S. Pharmaceuticals. Farmacéuticas ladronas. Finalista de concurso de costos más altos del PIB. 18% del PIB en salud en Estados Unidos. El 18%, el PIB es todos los productos y servicios que se producen en el país. El 18% va a salud, el costo. Ahí fui, there I went to Nicaragua, Managua, as an American citizen from a country supposedly that's on non-friendly terms. The imperialist Daniel Ortega says about the U.S., but it has 5% of the economy. I went to the ER Managua Hospital. There's the script. There's the hospital. 5% economy. I didn't pay a dime. Didn't pay a penny. Fui a un hospital en Nicaragua en el 2014. No pagué nada. No había los lujos. There was no luxury, no marble floor, no 70-inch plasma TV, you know, no air condition. But it was free. And it's only a country with 5% of the U.S. economy. Can the U.S. do better? Yes, they can do better. The greed is the brick wall. La avaricia es el tope, es lo que para. Now, this is very interesting. Look at this. If in U.S., this was from 2012 data, and if you look at 2013, 2014, 2015, 2016, it gets worse. It ain't getting any better. It's still the same SHIT. It's 18%. So if 18% is 100% Switzerland, strong economies, and sometimes stronger than the U.S. is not number 1 in per capita income, average income per citizen. It's way even below number 10. You know, it's number 15, 14 maybe. But it's not in the top 10. Switzerland, 64%. So we're 36% less than the U.S. Canada, Germany, Denmark, France, United Arab Emirates, Australia. So basically, most of those countries that are strong economies are doing it with, even Australia, half would be, instead of 18, it'd be 9. So they do it with less money. They do it with less, a much less percentage of the GNP goes to healthcare. Nicaragua, Libya, Argentina, Panama, Israel, Barbados, South Korea, they're all much poorer economy and still do it with less. In fact, out of 192 countries, over 55% do with single digit. O sea, less than 10% goes to healthcare of the GNP. De 192 países, el 55% tiene menos del 10% del PIB va a la salud. En Estados Unidos el 18%, doble dígito. O sea, there you see the astronomical picture when you have examples of stronger and similar economies and much weaker economies, and everybody does it with less. So if US at 18% is 100%, Nicaragua is 43%. They're doing it for 57% less than the US on the percentage of GNP. Look at those examples. It tells you a clear picture. It tells you the cost of healthcare in the US is astronomical. Amazing, alarmante. Some RX sold in the US at local pharmacy are manufactured outside the US, but they're sold in the pharmacies. Some US hospital, when you get a scan, the reading is done in India by a non-licensed US doctor. It's billed to the patient in dollars, not in rupees. Farmacias en Estados Unidos que venden medicina hecha fuera de Estados Unidos. Hospitales en Estados Unidos que te hacen un scan y lo mandan a la India para el diagnóstico. Lo lee un médico que no es americano, no lo facturan en rupees, en la moneda de ellos, lo facturan en dólares, porque es conveniente for the hospital. It's convenient for the hospital to do that. That's why they do it, and it's legal. They get away with it. It's legal. Cutting jobs in America. Part 2 is the details. The Medicare and the Medicaid brutality. The fear of a fix. The collateral damage, clearly explained. La brutalidad de Medicare y Medicaid. El pánico de la corrección. Collateral damage. Daño colateral. Jail the corrupt politicians. A la cárcel los malditos corruptos políticos. Thank you for watching the health program Corruption USA. The next program will explore the details of the prices, the details of the Medicare fraud, the Medicare abuse by Medicare. El próximo programa detallará el abuso de Medicare, la no impunidad del gobierno, the no impunity for government. Thank you for watching. Gracias por sintonizarnos. Salimos todas las semanas en San Antonio Public Broadcasting. We're every week in San Antonio Public Broadcasting. Have a blessed day. Tengo un día bendecido por Dios. Y la verdad, sin miedo y sin censura. The truth without fear and censorship. What the government wants you not to know. The truth. Lo que el gobierno oculta, que no quiere que sepa. Despierta. Wake up. That's reality. Esa es la realidad. Que tengan un día glorioso. Que have a glorious day with God. Thank you.